Culturally sensitive care. High-quality relationship-based care is central to children's early brain development, emotional regulation, and learning. One of the Program for Infant-Toddler Care, PITC, 6 essential program practices for promoting these goals is the use of culturally sensitive care. Caregivers take an important step toward practicing culturally sensitive care when they partner with families to learn about the care practices and rituals of children's home cultures, and then use this information to inform interactions and care routines. Care that connects with infants and toddlers' home experiences helps them develop a sense of who they are and value their home cultures. Thus, supporting consistent care at home and in childcare settings supports healthy development for infants and toddlers and sets the stage for integrated learning. Why is culturally sensitive care important for infants and toddlers? Honoring diversity strengthens relationships with families and children, which enhances quality of care and education. When a responsive caregiver builds relationships with an infant, the infant's ability to trust and seek support is enhanced. Culture is the fundamental building block of identity. Developing relationships with families and seeing them as partners in care is essential for providing a culturally responsive, high-quality infant and toddler care experience. Primary caregiving offers the opportunity to build relationships with families. Strong relationships make it easier for families to share beliefs, rituals, and routines that are valued in their home cultures. How does culturally sensitive care promote positive child outcomes? Culturally responsive care respects each infant's way of communicating and supports language development. Children who understand their own cultures develop a sense of belonging, personal history, and security in knowing who they are and where their family comes from. These qualities increase their capacity to develop a respectful understanding of other cultural perspectives. We learn to communicate and understand our world through the culture in which we live. Culturally responsive policies and services support infant and toddler learning and development. Planning to implement culturally sensitive care in diverse child care settings. Goal: high-quality infant and toddler programs provide culturally sensitive care to children and their families. Implement written guidance to support culturally sensitive care throughout the program. This guidance includes staff and family handbooks that share the importance of, as well as practices for, cultural sensitivity. Create job descriptions for infant and toddler teachers that include expectations for culturally sensitive practices. These expectations include examining one's own values and beliefs, forming relationships with families, learning about their home cultures and caregiving routines, and weaving home care experiences into daily practice. Attend, create, or advocate for professional development about culturally sensitive care teaching practices. Support ongoing conversations with families and teachers about culture and infant and toddler development. Use an intentional review process to continually strengthen a system of culturally sensitive care practices across the center or family child care program.